Welcome everyone to the COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. You know, we've got so much to talk about today. We're going to have really more like a roundtable discussion about COVID and race in America and, you know, and the real deal, what's happening, what are people thinking, what's happening, you know, are Black and brown people like afraid to take the vaccine? Should we get it? What about your kids? We just have so much to talk about. Tropikana is going to join me as a moderator. We're having just a few tech issues, but we are definitely overcoming those. So let me give a shout out to our tech team, John Reichel and Lauren Harden. Those of you on Facebook, you know, you can put your questions in the chat, and on Zoom in the Q&A, we're going to get to them. I'm one of your moderators, Jan-Michele Kearney, one of your city council members. And let me introduce our panelists. We're going to let each of them just, you know, take a minute to kind of give a quick intro, and then we're going to jump right into this discussion because there is a lot of confusion out there. There's a lot of misinformation, and we're going to talk about how things are looking from the inside of the hospital, so we can get the real deal. So let me introduce our panelists. You all just kind of, I guess, wave as I call your name. All right. We've got Dr. Lou Edgy of UC Health and the Cincinnati Medical Association. Dr. Jamel Bowers, Medical Director of Mercy Health Hospitalists, and she's with the Cincinnati Medical Association. Oh, and DJ J. Doe is going to join us later. He's from 101.1 FM The Wiz. We've got
He's here.
Oh, DJ Doe, you're here. Great. Okay, welcome. And we've got Miss Ebony J from 100.3 FM Cincy R&B. And we've got Joyce O'Farley, who is a parent of a CPS student. We want to hear from the parents. And as I said, Tropikana is going to be on in a minute. So
she's here.
Oh, Tropikana's here. Okay, so I'm not seeing everybody, but that's all right. You guys see everybody. And so we know you're here. Tropikana is my co-moderator. So Tropikana, welcome everybody, welcome. We look forward to a really high-powered discussion. But you know, we talk about the real deal here. You know, we give you the real information. We have the experts, and we have, you know, folks who have questions from the community. So we're excited to get started. Why don't we start by letting each of you just give us a quick intro, just like a minute. Just tell us, you know, make a statement. We'll start with Dr. Edgy.
Hi there, better known as Lou. Please call me Lou. I just wanted to thank Renee Mahaffey Harry first off. She's one of those people that once you meet her, you wonder why you hadn't met her before, and just really pleased to meet her. Also wanted to thank the Cincinnati Medical Association and the University of Cincinnati Medical Center and the College of Medicine for being my home. I'm a Moderna trial participant, and that was largely because as a practicing physician, I wanted to make sure that I was able to go ahead and speak to patients who look like me and let them know about the safety and efficacy, you know, the effectiveness of the Moderna vaccine. I also had been catapulted into the trial by watching the grief of my step siblings because my stepmother passed away from COVID early on. I've subsequently had 3 additional family members who passed on before the vaccine was actually approved. And I really want to make sure that nobody gets left behind and that nobody regrets not making the decision. So my job today really is to make sure that I can help translate any science into digestible nuggets so people can understand the science and make good decisions for themselves, and also to dispel any myths. Thank you for having me.
Dr. Edgy, thank you so much. Okay, Dr. Jamel Bowers.
Yes, hi, I'm Jamel Bowers. I am the Regional Medical Director for Sound Physicians, and we take care of inpatients in the Mercy Medical System in Cincinnati. So that's 5 hospitals around Cincinnati. So I'm one of what you would call a frontline worker. So I am seeing COVID patients every day that I'm practicing. I also am in charge of inpatient physicians in several sites in Indiana, where the crisis is just as bad, if not worse, as it is in Cincinnati. I was in the Pfizer trial, but I did get the placebo. But again, I understand the science of it, just like Dr. Edgy, and I'm more than willing to speak about it. And I did get the Moderna vaccine, and I'm due for my second vaccine on Wednesday. And just to put in a quick plug for my dad, we did do kind of a PSA event on Monday on Channel 9 to kind of talk about how important it is for people of color to get the vaccine of all ages and how important it is.
Yeah, and everyone knows your dad, Dr. Walter Bowers. I mean, he's probably delivered half the babies in Cincinnati. So very exciting. Okay, DJ J Doe.
Okay, I'm here. My fault. Hold on, my phone was.
Looks like you're driving somewhere.
Yeah, I was driving, but I'm done driving now. I had to park. But I'm DJ J Doe, radio personality, mix show DJ for 101.1 The Wiz. I think I'm one of those type of people, well, young people who are really not interested in getting the vaccine. I'm not really interested because of just the myths that go about it and just the information about it and just how it came about so far. It doesn't really sit comfortable with me. But I'm open to hear why that I should. And maybe somebody can change my mind, but right now I'm totally on the fence of I'm not going to get it. I don't want to get it. And that's just how I feel about it. So yeah, I'm here and I look forward to speaking with everybody and, getting to hear how everybody feels about it.
Yeah. And, Veronica's already asking, what information do you need to make a decision? So we're going to come back to you. You're not alone. You're not alone. There are a lot of people who think just like DJ J Doe. So we're going to talk about that. Okay, Miss Ebony J.
I am Queen Miss Ebony J. My goal is to help kings and queens live out their purpose, and I do that through events. I sell merchandise to push the message, and I also host events. My big thing is I've always been 1 in a million. So I've had a hernia, I've had blood clogs, I've had issues with my throat and my body. And when I go to the doctors, they're always saying, we're so sorry this happened to you, but this only happens to those that's 1 in a billion or 1 in a million. And so because that's always been my statistics and that's always been my story, I am terrified of the vaccine and I am totally against it. And so I'm on here today to ask questions because I know I'm not the only one who have had 1 in a billion and 1 in a million experiences. And after even talking to my doctor and my mom, that has become my best decision based upon the fear. So I'm just all about getting facts out and not feelings. I'm always about making sure that the community has the information that they need to make an educated decision. And so that's why I'm here today. That's where I'm at too. I'm trying to figure out what information more do I need to know to make sure if it's the right decision for me as well as for my family. So thank you so much for allowing me to be a part.
Okay, that's great. Thank you so much. And now we have a parent, Joyce Farley.
Hi, I'm Joyce Farley. I am the mother of a 2nd grader who attends AWL. He's 7 years old, and I also have 2 little cousins that are in Cincinnati Public Schools at the high school at West High. Far as the vaccine is concerned, I'm on the fence about it as well. I agree with J Doe about it. I have an underlying health condition, and my doctors want me to take the vaccine as well as my family, but we had already experienced COVID in June. So I'm like, okay, well, we have the antibodies, so why do we need to take the vaccine now? So I'm here to listen. My father has already took the vaccine, so he's been like, I've just been watching him.
Messing around with you all. Fucking debated. I'm getting my vaccine. I hear you. Right.
Yeah, so I've been looking at him. I'm calling and asking him, how's it going? Right. So I'm here just to get more information and see if what the decision may be soon.
All right. Okay. Well, that's we're here to get the, as Ebony J said, get the facts out. Tropikana, you want to weigh in and say something? Where's Tropikana? She's on here.
Here. Hey,
there you go. Hey, Miss Tropikana, how you doing?
Glad that we are having this conversation, and I'm this is how we know it was live, because I didn't know that all three of them were going to get on here and say that they were all scared of getting the vaccine. I reached out to all three of them because I know they're very honest. The truth is, this is really a representation of that 18 to 34-year-old demographic and the fears, the misconceptions, the all deal with ourselves. So I'm kind of glad that they said that so that we can get that information out that they need to hear. I've been privy to sit and listen and learn from Dr. Edgy as well as Dr. Bowers and the really amazing professionals who have come on, but I'm one in a million for that. And I'm thankful for it. But this is an opportunity for them to be the representation of the peers that they listen to and that we hear every day that say the exact same things that they're saying. So I'm happy and excited to have this conversation today.
That's right. I love it. Okay. You know what? So I wanted to go first to Dr. Bowers. So Dr. Bowers, you were telling us you just got off of work and you were just saying, you know, what's it like on the inside of the hospital? Like, you know, tell us about your experiences.
Yeah, it's rough. It really is a war zone, and it's been going on now almost a year. So I guess I would say starting in January, February, we started having patients that were just dying, and we didn't have the testing available. We didn't quite understand why. Then we started realizing this is really COVID. It was here kind of before they really announced it was here. It's been around for probably since last December, January, and it's just been steadily increasing. The death is on a scale that you just can't even imagine. When you just have patients who within 24, 48 hours of coming in the hospital, you know that they're probably going to end up passing away, whether it's a few days or a few weeks. Very few of the people who get to that point make it out. And we're not talking about people in their 80s and 90s. We have those. We have people in their 30s. We have people in their 40s. We had someone in their 20s. So it's not all old people. It's people of all ages. Everybody does not always have an underlying medical condition. So while diabetes, high blood pressure, obesity really do not help you, we have patients. I have a patient now in his low 30s who had COVID, kept feeling poorly, came in with blood clots in his lungs and strokes. Okay, and this is directly from COVID. He has no underlying medical conditions, nothing in his family. This is all COVID. So
he was in his 30s?
Yeah, he's in his 30s, his low 30s, yes. Black man, yes. And so now, luckily, you know, he got in the medical system and he's going to be okay. But he could have died at home. This is very serious and it affects people of all ages. And it's like Russian roulette. You don't know who it's going to get. And you may think it's not you. It may be you. It could be your mom. It could be your sister. It could be your brother. Because if you're not taking care of yourself and you're spreading it around, you literally can kill someone else. And just real quick plug on if you've had it before, the immunity kind of lasts, they're thinking probably about 6 months. And then we are seeing cases where people are getting it again, and you can get it again. There are different strains that are going around to where you can get it again. My mother-in-law, who lives in Holland, is now getting her second case. The first time she was not really sick at all. She tested negative 3 times. She's in a nursing facility. Now she's positive again with symptoms. So,
and to that, yeah, and to that point, being in the Moderna trial, they do actually go ahead and they took 8 vials of blood every single time I've gone in for my visits. And there's some patients who have 0 antibody responses to this. So, which means that your body, you know, we've had some patients who actually don't even have any sort of response after they've gotten actual COVID. And so definitely can get it again. Also, the antibody response that you get from just having COVID does not guarantee that you'll have the neutralizing antibody in that army that builds in your body. So that's where getting the vaccine, at least you have a predictable, strong response from your body for each of the shots that you get. And it does still right now require 2 shots to get the best immunity.
Right.
One thing, just to go back to DJ Doe, just want to make sure I got that right.
You can just say J Doe.
J Doe. Okay, yeah. J Doe. Thank you. Just being on the fence, one of the things that I've found that's really important is to come to this forum with respect and compassion for your position, to just understand that. I am a Black woman. I live in a Black family. My grandmother is 97 years old. She's lived through the whole Tuskegee. She knows this. My mother-in-law lives with us as well. She's in her 80s. So I'm a Black woman living in a Black household, and I know I've got family members who have been skeptical as well in the past. So here are a couple of things. Number one, there are 3 major ingredients in this. There's no abnormal chips, and there's no fetal tissue. There's nothing like that. The 3 major ingredients. Number 1 is mRNA, which basically is like a Snapchat message of one piece of the virus. There are 29 pieces to the virus. It's one of the 29 pieces on the outside, and it's a Snapchat chat message of how to make that little spike. And that is covered in a little bit of fat, which is the second ingredient, and a little bit of sugar. And that's what gets injected into your system. That's it. No preservative even. And that's why for the Moderna vaccine, it stays at room temperature for 12 hours, and it can stay in a doctor's fridge for 28 days. And then it expires because they said, we're not putting anything in it except what is absolutely needed to get it to where it needs to go. So the mRNA, that first ingredient, breaks down within 24 hours, then it's gone. But it stays in your system like a flash long enough for your body to say, when I do see the real virus, I know how to dismantle that virus next time it comes around. And so that is what that vaccine is. And within 10 days of the first dose, your body's already started to mount a response in defense of your system. And as you know, the other doctor mentioned here, the young folks who are 32, for example, had they gotten the vaccine, they wouldn't be having the strokes. And we know this because it is safe. 0 out of the 30,000 people in the Moderna trial got hospitalized or got death from COVID, out of 30,000 of us who stepped up first to be in line first.
Yeah. And you mentioned young people. And let me go back to Dr. Bowers for just a minute, because before we started this broadcast, Dr. Bowers was talking about, even 16-year-olds. I was laughing about my son whose friends wanted to have a party Sunday. And I'm like, you know what? We're in purple. Hamilton County's in purple. You're not going to any parties. Are you crazy? But 16-year-olds are thinking, why not? So tell us about even that age group.
Right. So there was a student at Moeller High School. He just got discharged this past week from Children's Hospital, and he had a minor case of COVID, didn't even know that he had COVID, then started developing rash, abdominal pain, feeling ill, and was diagnosed with a severe inflammatory condition that is unique to kids and teenagers. And he ended up in Children's Hospital ICU. They're now seeing between 2 and 4 kids a week with this disease. And this is no joke. This is ICU level care, intensive care unit. And there are kids who were dying of this process. So it's not benign. Most kids do okay, but not all of them. The other thing to remember is that your kids may get it and be okay. But in my child's school, the kids went out and had a Halloween party, weren't wearing their mask. High school kids went home. A high school kid infected his father, and his father passed away. So even though you may think that your kids are fine and maybe they're fine, they may bring it home to you or your loved one, and then your loved one can suffer significant consequences.
And as of yesterday, there are 11,000 active cases of COVID in Hamilton County. 11,000. That's a lot of people.
Wow. J. Doe, you were going to weigh in and say something. Go right ahead. You all just jump in.
I was just responding to Dr. Lou. I think my biggest thing is, for one, not only what's in the vaccine, but I feel like this whole process about the vaccine has been rushed versus something like the flu vaccine, where that's been going on for years, and it's been years of research and everything like that, versus this COVID vaccine is just it was so rushed, where as of now it's only been around that I know of for a year and a half, and versus other vaccines, it's they've had 7 years worth of trial and error to find out what's going on. And
Right.
that don't sit right with me. Like,
right.
I feel like it's just rushed.
No, that's a brilliant point. So let me just explain. So the SARS-CoV-2 virus, which is what causes COVID-19, the disease, is part of the coronavirus family of viruses. And that family of viruses has actually been studied for almost 20 years now. And actually, the woman who is the one who developed, she's one of 2 scientists that helped develop the Moderna vaccine, is a Black 34-year-old woman. Yes, Dr. Kizzmekia Corbett. She works with Dr. Fauci and the NIH. She has been working for 6 years on this family of drugs. And like I said, they've been working on it for 20 years. So the only thing that they knew when it just came out in February, they knew that they had to focus on one little piece to solve the rest of the puzzle. They had solved the whole puzzle for those 20 years. They only needed to find that one little piece. And it's just like the cake had been baked for 20 years. And now they just had to find the flavor of the icing. And that's what took the last year. Finding that flavor took 66 days. And then they went ahead and did the trial. So the point of the matter is that this has been going on for a full 20 years of research, solid research. And that one little last piece is what took that last little year there to develop.
So with that being said, we know that it's a new strain of the COVID that's out. Will this vaccine help with the previous strand and the new strain?
That's a great question. So the word strain, it's different than the flu. The flu has strains. They're completely different from each other. This is different than a strain. This is a mutation. So it's just one little change that has happened. And this is the B117 that you're talking about from the UK and then South Africa and so forth. What we do know about it is that it's much more infectious, meaning that it can be transmitted from one person to the other much easier. It doesn't give you any more severe disease. And we do know that the vaccine right now is covering that B117. So, and they did anticipate that there would be a change that would occur, mutation, just because it's been around for this long, this year and a half that it's taken for us to try and get rid of it. So yes, your mRNA vaccine, whether it's Pfizer or Moderna, should actually be able to go ahead and cover this mutation. It's not a new strain, it's a mutation.
Okay. What's the difference in the vaccines?
So the difference in the vaccines is how they need to be stored, for one thing. That's one of the biggest issues. Also, the time between taking the first one and taking the second one. So Pfizer, there's a 21-day period of time between the first dose and the second dose for it to do what it needs to do. The Moderna, it's 28 days. In the Pfizer, it has to be stored at a much lower temperature, -70 degrees, which is some of the difficulty in the distribution and the storage. Whereas, as I mentioned previously, the Moderna doesn't need to be stored at those frozen temperatures. It does need to be thawed, but it can be stored in a fridge, in a doctor's fridge for 28 days.
And so how do you know which one is supposed to be for you? How do you know what's the best decision?
So you can actually use either one. It's whatever's available.
Okay, you just have to get the same one for the second dose.
Yes, first and second need to be the same. So Pfizer, Moderna.
Yeah, you can't switch. And the other thing, there's one that's, I think Johnson & Johnson is coming out with one where you only need one dose, isn't that right?
Yeah.
Okay.
That one's coming.
So right now we think,
you're saying you can get either one, but you just named like 2 different ones. Like, how do we know which one is for us or for our body? You know, Moderna may have some side effects, or this one may have this side effects, right?
They're largely the same as far as that goes. So really, there's no significant difference. The 5 major side effects that you get from both of them would be mild fatigue, a possible low-grade fever, body aches, joint aches, and a little bit of headache. So those are the 5 major things, and you'll get that from either one. We were tested in the Moderna trial, and they made it. I'm very proud of what they did with the Moderna trial. They tried to make sure that they were reflecting the same number of us, Black and brown folk, in that trial as the general population, because they did not want it to be said, hey, this was tried in people who don't look like us, Now, don't tell us we're going to take it because you didn't try it in us. That's part of the reason I'm in this trial. And specifically, they halted their trial. They slowed it down and said, at this point, we're not going to enroll anybody else until we are able to catch up and have as many Black people in this trial and Latinx people in this trial so that it reflects the community, sickle cell people, so on and so forth, everybody, that they could fit into that so that we had some good data.
Oh, that's great. And Tia, Rochelle, you were just asking about side effects. So Dr. Edgy just answered that question. I was going to ask back to Ms. Farley, you know, what are you thinking about having your children vaccinated? Because I don't know that children were included in the trials.
That's what I was just about to ask. Okay. That's why I raised my hand. So if the doctor can't answer.
Yeah, so the Moderna trial only went for 18 and above. And the Pfizer was only approved by the FDA and the ACIP, which is the body that determines how frequently you do your measles, mumps, rubella, et cetera. It was only approved to age 16 and up. So right now we only have 16 and up, but Children's Hospital has already started to enroll kids in the trial so that they can go ahead and have some answers to that question about kids getting vaccinated.
And they were asking for kids for the Pfizer trial as well.
Yes.
And do you know how long the trial will be? And how long the trial will be?
Yeah, so I'm in the trial for 25 months, the Moderna trial I'm still in. I found out, and I'm going to put this in here. With Tuskegee, the problem with Tuskegee, the experiment was you had all these men who had syphilis, and the concern had been all of a sudden we found out penicillin worked, and they withheld the penicillin from those individuals and kept them in the trial for years. Unethical. There was a horrendous issue, should never have been done. And so since then they have these things called IRBs, which is a body of people who check every single trial before a single person is enrolled to make sure that there's no problem with ethics. And for that reason, when we found out that the Moderna vaccine works, we had to be notified immediately. Dr. Edgy, you come for an unblinding visit and we find out whether you got nothing or you got the Moderna. And if you got the Moderna, great, you can continue. But if you got nothing, we have to offer you the Moderna. That is what we have to do by rules. And so, you know, again, at that point, you know, it was just the way it was. We were going to go ahead and get that vaccine.
Okay, I have a question. I know you had listed some of the side effects that went along with both of the vaccines, but I know I've been hearing about Bell's palsy and men having issues with infertility in their sperm. Or have you heard anything about any of those side effects as it regards to any of the vaccines that you just named?
So two things, the Bell's palsy, there were 4 people in the Moderna trial who got Bell's palsy out of 30,000 people, and they were all in the placebo limb. So the people who didn't even get the trial vaccine, right? Which is exactly the same number of people who would have gotten it without being in the trial. So when you get in a trial, you either get vaccine or you don't get vaccine, and we see how you do. And all the ones that got Bell's palsy hadn't even gotten the vaccine at all.
Right. So
right?
It was not related.
Even if COVID even if COVID hadn't happened, still those 4 people would have gotten the vaccine. So that's the first thing. And what was your second question?
Infertility.
Infertility. So as far as infertility goes, your DNA, which makes another ebony, okay, all the instructions on how to make another ebony are locked in a safety deposit box in a portion of your cell called the nucleus. It is a locked box and nobody gets in there. And the mRNA has no access into that. So it will not change your DNA. It will not change fertility. And that's why they're recommending that if a pregnant woman wants to get the vaccine, go right ahead and get the vaccine. It will not cross into the fetus as far as their DNA. It won't scramble any of their own DNA. It has no access. There's a lockbox.
But so, Dr. Edgy, now pregnant women haven't been in the trial either, have they? Or is that happening now? Like with children?
So they did not enroll any pregnant women in Moderna, but 23 women became pregnant. Okay. And they're following those women. And so far, so good, right? But we don't enroll pregnant women because of ethics. But they became pregnant anyway, because life is life. And so now that they're pregnant on their own, we're just following and making sure that there's no problem. But again, because the DNA is locked in a safety deposit box, there is zero access to the mRNA, which is what gets injected into the body.
Okay. And then Easy Connect is asking, is it safe for teenagers, or can teenagers socialize at all? Well, what about when they are in school?
So in school, when you're maintaining the social distancing, you know, most of the classrooms where people actually are in school, the desks are supposed to be 6 feet apart. You're supposed to wear your mask at all times unless you're out on the playground. And if you're out on the playground, you shouldn't be close together. So in those cases, you know, all three of my kids are in school. Well, they're not actually in school. I decided to keep them home. But they're in online school, which is the whole day. So with the friends that they have, none of their friends have become ill. And the outbreaks that you're seeing that may occur are typically occurring, like I was talking about the Halloween party. So people are getting together outside of school, and that's primarily where the transmission is occurring. Yeah.
Okay.
Same with teachers who are getting ill. A lot of it's coming from the community.
Okay. And then
the other thing is eating, I think, because the three main things are hand washing, which we should always be doing anyway, masking and socially distancing. But when you're eating, you're removing one of those barriers, which is the mask. So that's a little bit of a risky spot for a lot of different people.
Okay. And then Tia Rochelle said, does the vaccine ensure that you will not contact COVID-19?
They don't really know that. They're not certain if you still might be able to transmit it. So that's the kind of where the data is still out there. But the people who have gotten it have not become, you know, deathly ill. So if you do get it, it's kind of like you may get the flu. My child had the flu vaccine, still got the flu. She had a mild illness and then she was fine. And the people that we see kind of in the community, this happens with the flu vaccine every year. Some people still will get the flu if it's kind of changed a little bit, but they're not typically getting critically ill.
Okay,
so
great.
Specifically to the Moderna vaccine, we had 30,000 people in the trial, and 94 out of 100 people, if you go for every 100 people, 94 of them got zero even disease whatsoever. And you only had a few that did end up getting severe COVID and dying. So nothing was an issue as far as that goes. So again, safety and efficacious for sure.
So here's another question from Facebook, and this is from Kathy Curitan. And she said, it's a good point. We may need to speed up the vaccine in Hamilton County because CPS is trying to go back to in-person, even though our county is purple, which is the highest, you know, the worst rate of COVID. So are we going to speed it up? What's going to happen here? We're not rolling it out. It seems a little disastrous the way it's being rolled out. No fault of anybody here, but you know,
I'm hopeful for a national response in the next week and a half.
Yeah.
So next 4 days, maybe.
Yeah.
Okay. So we're going to wait for the new president. And apparently he's got a plan because we need to get things rolling. Okay. Here's another Facebook question. And this is from Kimberly Brooks Bonds. Great question. How long does the vaccine last? Do we have to get it every year?
I can answer that one. So typically what happens with vaccines is if you go ahead and get immunity that lasts for 4 months, it's very likely that it will last for 1 to 2 years at least. And we're hoping that it will last a lifetime, but we don't know that yet. I'm enrolled for 2 years, so 25 months to help answer that question. So even though I found out that I got the Moderna vaccine on September 12th and October 14th, I've stayed in the trial because I want them to continue to check my antibodies all the way through 2 years. But like I said, typically, if you get past the first 4 months, then typically you're going to actually have lasting immunity for at least a couple of years.
Okay, Tropikana, I know you were weighing in on this.
Yes. Dr. Lou, based on being symptomatic or asymptomatic, did you have any symptoms which would lead you to know if you received a placebo or the actual vaccine? That question is coming from Veronica H.
Yeah, absolutely. It's a great question. So it was a bit of guesswork there because I didn't get unblinded. So you have an unblinding visit to find out whether you got it or you didn't get it. Like I said, when they found out that it works to protect people and it's safe, they were obligated to bring me in. So last week I went ahead and came in and they told me which I got. I can tell you, I for sure thought I got the vaccine because the second vaccine is what we call more reactogenic. So you're going to have more symptoms after the second shot. And my arm felt like lead. I mean, it was just heavy and it was sore. That lasted for 24 hours. And I was like, there's no way that a blank would have given me that much discomfort. And so I thought for sure October 14th and 15th that I had gotten the vaccine. And then I found out on the 6th of January that I did get it.
I was in the Pfizer trial and I was 100% sure I did not get it because I had nothing. It felt like they just injected my arm with salt water, which is what they did. Yeah. And I kind of suspected that, and they told me that it shouldn't be a deterrent if you have the opportunity to get the vaccine. And so I actually went ahead and got the Moderna vaccine when it was offered by my hospital, so that I didn't, and then they unblinded me and I was correct.
Okay, all right. So J Doe and Ebony J and Joyce, I'm just wondering, you guys are really hesitant about this whole vaccine. Are there questions that you have that we haven't answered? We talked about infertility. We talked about Bell's palsy. I mean, what are we missing?
Yes, if I have to, my thing is, if I'm going to have to still wear my mask, then why should I get the vaccine?
Because, yeah, so the vaccine protects you. Mm-hmm. We wear our masks to protect other people, mm-hmm. because we don't know whether the vaccine protects. You can still have virus in your nose and somebody else get it from you, but it's not going to hurt you when you've gotten your vaccine, but it can spread to somebody else. And right now we want you to continue to protect other people. So this is why it's really important that everyone get vaccinated. We predict that you have to have 70%, so 70 people out of 100 vaccinated so that the virus has no place to go. There's so many people between each other that the virus can't get to the one person. And that is why I'm doing this show today, because we have to get there. Otherwise, we're going to be masking and socially distancing and hand washing.
Forever.
Always be hand washing, but forever, right? Because we will not get out of this. This is escalating. The numbers are going up. Somebody is dying every 8 minutes in Los Angeles County as we speak. And 71% of us know, as African-American, Black, and Latinx folks, all of us know, so 71%, 71 out of 100 of us know somebody who's had severe COVID or died from COVID. Mm-hmm. We are disproportionately affected. We are affected more than anyone else. Mm-hmm. And we are some of the most hesitant people as far as getting this vaccine.
And it's killing us. It is.
Yeah, it is killing us. And I don't want somebody to regret. I've got 4 people who are not going to be at my dining table. And I wish I could be in line with them to get their vaccine. And I don't want somebody to regret and say, what was it I read on the internet that made me not get this vaccine and my kid is dead now? I don't want anyone to be in that position. That is why I'm here today.
So J Doe, how are you feeling after this part of the conversation? Are you still thinking, I don't think so, or what?
We lost Doe.
Oh, we lost Doe. Okay, Miss Farley.
I'm still on the fence because long as I've been an adult, I never had a flu vaccine. I never caught the flu. Yes, I was unfortunately to catch the COVID in June. My son never had a flu vaccine either. So it's just, I'm real confused. I'm sitting here, I'm listening to the pros and cons.
The flu is a bit different, and it's very different. In fact, the flu vaccine, is a completely different vaccine. The science behind it is completely different. The flu vaccine has a different makeup than the mRNA. And like I said, it certainly we haven't actually seen a lot of flu this year at all, because people are doing what they need to do to prevent its spread. We're wearing masks, we're doing all the good things, right? So you're fortunate that you haven't gone. This is completely different. COVID is a different body. There's a different vaccine, and it is killing us like no other disease that we know of.
And Dr. Bowers, you're there on the front lines too. And I think you said that you see people who haven't had any pre-existing conditions. They haven't been sick. I mean, they're like the people Ms. Farley's talking about.
I mean, it doesn't help if you have the underlying conditions which affect us a lot, which are diabetes, high blood pressure, and obesity, right? A lot of those people who make it into the hospital aren't doing well, or it takes them a long time to get better, and they're going home with long-term issues, right? That's the other thing about COVID, is that when you leave the hospital, you're not 100% running around. A lot of times I'm sending you home with oxygen that you're on for weeks to months, and people are still having symptoms. So just because you make it through doesn't mean you don't have, you're fine. I have people we send home, they keep coming back with more and more, different respiratory issues. But again, I have patients who have the major risk factors. I have patients who have no risk factors, and we don't understand why they get it. That's why it's like Russian roulette. You don't know who's going to get it so bad that it's literally going to kill you. And the heartache that you see when people realize, because they know when you get to a certain point, that you're probably not going to make it. And that's really heartbreaking to have those conversations, and you sit there and you call their family, because family can't come in and visit you. You might be able to visit other people in the hospital, but you can't come on the COVID unit. They may never see their loved ones again. And that's really heartbreaking.
Can we catch COVID if we get the vaccine?
So it depends. The window for the vaccine to actually take its full effect, there's a 10-day window after the first dose before your body starts to, to show the immune response. So yes, if you catch COVID between taking the shot and that first 10 days, you can get COVID before your body's gotten the full protection started.
But after you get the full protection, though, you're saying you're safe.
You're safe. Yes.
You're merely wearing your mask
to prevent you from giving it to somebody else, because the virus can be in you can sneeze the virus out. The virus has no legs and arms. I mean, it won't move anywhere without you propelling it by a sneeze, by moving it from your hand onto a surface, onto someone else. And so you can still move it from you, even though your body is able to fight it for yourself.
So what she's trying to say is you can get what we call an asymptomatic infection, meaning that you may still get the virus, but it wouldn't affect you, and you may not even know that you have it, because that's how much that vaccine is working. Okay. But we don't know, you can still potentially spread it if that happens. So you still need to wear your mask and be socially distant.
Okay. So I got another question.
Hold on one second, though, because I see Ebony's face. And Ebony is looking at how I look when they said that. Yes, you can get the vaccine, and it'll make us immune, but we still can get it and spread it. We're just asymptomatic after, where you won't get sick. Am I saying that right, Dr. Edgy? Can you kind of speak to that? Because you saw her face when you said that you have the virus and you need a mask after getting a vaccine. Can you speak to that?
Yeah, absolutely. So basically, when you get the vaccine, your body's army is put into standard attention, and your army is at work keeping you safe, but it's not at work keeping their body safe. And you can sneeze the virus out. It cannot do anything to you, but it can still sit in your nostril, and you blow that out onto somebody else. And now it's got a new person to get into, has no army, no protection to help them fight it off. You got your army. That's what you got from the vaccine. Your army's on charge. It's standing at attention. It's ready to go, and it's fighting that virus. But again, the virus can still be on you, and you sneeze it out. You send it out to somebody else. They haven't got an army. They're going to get it. It's going to ravage their body, just like Dr. Bowers said.
Dr. Bowers and Dr. Edgy, I think that for our generation, Joyce, Doe, myself, Ebony J, we all kind of have the same type of thought process in the sense that we've never lived through a pandemic. We're not on the front line. Don't get a chance to experience the devastation and the losses that you guys see on a day-to-day basis. For the most part, we, have done the rules that you have told us, wear your mask, socially distance, and wash your hands, and we have believed that to make us safe, and that it kind of keeps you like, as long as I'm doing that, I'll be okay. How can you just kind of speak to that? Because I think that that's a part that we are missing when we compare the flu to the coronavirus, because that's all we know when we think of a vaccine. Like, we know the flu, and I survived the flu. I don't need a vaccine. The vaccine isn't going to change anything. It's the flu. I'll be okay. I can survive the flu. And people are comparing it to that. When we think of pandemic, that's a big word to use. But I just don't think that our generation is fully understanding that this is deadly. It's unpredictable. Can you kind of speak to the severity of it? Because I think that's kind of what's not being grasped.
And my question kind of went in with your question, Trop, because my thing was, if you get the COVID vaccine, do you got to get the flu shot too?
That's two different diseases, completely different diseases.
Right. So you have to get both of them, basically.
And the flu vaccine is actually every year. The flu does actually have a new strain every year, and that's why you have to get a flu shot every year. That's a completely different disease than the coronavirus.
So you'll basically, to stay safe, you have to be safe, get both of them.
Yes.
And you see, the thing is that our generation is comparing the flu coronavirus as if it's the same thing. Like, I've survived the flu without getting the vaccine, so I can survive COVID without getting the vaccine. And I think that is...
It attacks different organs. In fact, COVID attacks just about every organ system we know. That's one thing. And it does it to folks who are not at high risk, which is a little different than the flu as well. And so, I will talk about, my daughter. She's 22. She's in your age group. And, she's at college. She's a senior in college. And I've had to sit down and talk to her about having her mask and so forth. Because, it's like, you can't see it. It'd be different if it were bubonic plague and people's fingers and toes were rotten off and you had big blisters that had pus coming out of them. People would see this completely differently, and boy, you'd be masking. You're like, no way, I don't want that. But this virus is microscopic, and you have to think about that this virus actually can kill you. And I'll like I said, my daughter's uncle, bodybuilder, reggae guy, tough as nails, sweetheart, no health issues. 8 days later, dead.
Oh my God.
Watching her grieve broke my heart. Okay. And if you have strong enough information, strong enough beliefs about something where that's okay to have that be the alternative, then, that's something that's out there. But I got to tell you, you never want to regret it. You need to make sure that whatever decision you're making has got really good information behind it, because you do not want to be in a position to have your brother or your sister or your daughter's friend die because of this. And it goes like this. It can be one weekend they're here and the next weekend you are burying them.
They're gone.
They're gone. And there was nothing you could do about it. And you're like,
never see them again.
Yep. And that's the hard part.
And so, Veronica H is saying, first of all, I would, Jay, hold on 1 second. I'm going to let you jump right in. But Joyce, Veronica H is saying, Joyce, Ebony J, and J Doe, thank you for your honesty and questions. So many people feel the same. Hopefully they've received enough facts today to share the facts with others. And Veronica says, please spread the word about this wonderful series. Oh, thank you so much. And she's also thanking Closing the Health Gap for these phenomenal panelists. So I just wanted to throw Veronica H's comments in. J Doe, go right ahead. I'm sorry, I did not mean to cut you off. J Doe, are you with us?
It looked like he froze.
He froze a little bit.
You are good. My thing is that, can you hear me?
Yeah.
All right, hello, can you hear me better now?
Yes.
Okay, see, my thing is that, like, from my understanding and everything that I'm getting from this is that I'm getting that I can go get the vaccine. And if I get the vaccine, then basically it will make, if I catch the COVID COVID, then I won't have any symptoms or anything like that, but I can still pass it on. So it's like, if I get it, I can still pass it to other people. So
but you
it
won't
doesn't
get
sound like it's protecting anything. Only thing it's protecting
you.
is just, I guess, minimizing my symptoms.
No, it's protecting you from getting infected. I mean, a virus can actually sit on you and not do anything if you've got the Moderna vaccine in your blood system or the Pfizer vaccine in your blood system, because your body's fighting it. It fights it off, right? It does not shoot it off. It doesn't shed itself, away from you. The thing about it is, you talked about the flu too. The flu you need to take every year, but the Moderna, we're hoping you just need to take 2 shots, 28 days apart for Moderna and 21 days apart for Pfizer, and then hopefully not need to take anything for at least 2 years or for the rest of your life. So it's not like you're going to be taking, that shot with the flu every single year. I mean, this would be a one-time deal, hopefully, for this particular set of series.
You're saying hopefully, Dr. Lou, that means there's no determination yet? They haven't decided?
We haven't figured that out, but we know for sure that it has lasted, the immunity has lasted for 4 months. And historically, if something lasts, immunity lasts for 4 months, it's most likely going to last for at least 2 years. And that's why I'm still in the trial for the full 25 months, because they're checking my blood each time and saying, okay, your immunity is still good, your immunity is still good. And they'll keep doing that until we get to the 2-year mark. And they'll want to make sure, and then we'll have the full data. But historically, if the immunity has lasted for these types of viruses for 4 months, it almost always lasts for at least a couple of years.
Now, you said you're in the trial, Dr. Lou. Does that mean if I go to Kroger's and go get the vaccine tomorrow, I'm in the trial too?
No. Yeah. What that means is that as far as it goes, when we found out what ingredients needed to go into the vaccine, 30,000 of us put up our hands and said, we'll be first in line, try it on us first before you give it to the general public. And then what ended up happening is, usually if you have adverse events or bad things happen, they happen within 6 weeks. And so what they did, and this is why they had a 2-month period of time, so just beyond 6 weeks before they brought it to the FDA to say, hey, you can check this out and see if we can roll this out to the general public. Because in that 6 weeks, we knew every bad thing that could happen was going to happen in that first 6 weeks. And once we knew, then we're like, hey, this is really, really safe for people. Let's go ahead, and we're able to now roll it out to the public. So we were the first guinea pigs in line. We did that voluntarily, and there were 30,000 of us who did that, so that you wouldn't have to be in the first in line. You wouldn't have to be the ones who people try and figure out, does this work? Is it safe? Is it not safe?
So really, thanks to the people in the trial, those vaccines have been approved, and so now the public can get them. Right. So, and Kay Beck from Facebook, I think we answered your question, which was, I think it's important to talk about how folks can be asymptomatic, but the spread can still affect the next person differently. And that was DJ J Doe's question too. And here's someone else from Facebook who's saying, and this is Simone Charles. And you're saying this whole thing about school is a major concern. How are we going back to in-person teaching when we just entered purple status? So that's a good question for Joyce Farley and for Dr. Bowers. Dr. Bowers, you're keeping your kids at home.
Yeah, my husband and I elected to keep our kids at home. So they're still and there's no way I'm going to send them back now that we're purple. The goal was, once my husband and I were vaccinated, that we would send them back to school, but certainly not if we're purple. And again, I only see the bad, right? So I don't see people who are healthy getting COVID. I see people who are coming in and they are sick. And I see it affecting everybody. So that is a little bit different perspective than people who don't see that. And I just want people to realize, the perspective that I see, that everybody doesn't do great or have a week of feeling bad and you're fine. People get deathly ill or they really die. And as far as the school, again, that's my personal choice with my family. I know that some people, they have to send their kids to school, or their kids really need that because of whatever needs they have, whether it be social, economic, or the learning disability. And so if they do go to school, you have to make sure that they are protecting themselves, and you have to teach them that, just like you're teaching them what to do if a cop pulls you over. Like, you have to really ingrain that in their system. You wear your mask all the time unless you're eating. You always wash your hands or use hand sanitizer, which you should be doing anyway. These are not, abnormal things. And don't go up and whisper in your friend's ear. You got to stay apart. You have to.
And one thing I'll say, don't forget to do the motorcycle. I call it the motorcycle. When you're washing your hands, don't forget your thumbs. Vroom, vroom. Because, and that's the one thing I use with the kids, because everybody forgets their thumbs. They're really good about this. And then when if you even put black ink on your hands and wash your hands thinking about it, and you'll know which areas are actually not covered, it's almost always the thumb. So motorcycle on both thumbs, and make sure you wash those as well.
Dr. Lou.
I was gonna say, we're down to 5 minutes, so we still want to hear comments, and really interested to hear if anybody's been convinced. Ebony, go right ahead.
I want to ask this last question, okay? Because I'm still scared, but I will ask this though, okay? Because I really am terrified, because all the situations, like I said, being 1 in a billion.
Oh, you froze.
At the hospital, and later on, when we dealing with it, they don't really have that much advice.
You froze up for a little bit, Ebony. Could you just repeat that? I'm sorry. I'm
sorry. I said I really am scared about this decision, but I understand the severity of it. So my question is like a hypothetical. So if I was to go and say, okay, after this, I want to try it. I want to try the vaccine. I get the vaccine and it's like 7 days in, and now I'm bleeding, or now I'm having some kind of effect. What kind of plans do you all have if the vaccine isn't going good with somebody? Is there a way to take the vaccine out and save them? Or, I guess that's kind of, I don't know, maybe that's a crazy question. I'm just trying to figure out if I did make the wrong decision, can I come back from it, or this is already like life and death?
That's a great question.
So nobody, 0 out of 30,000 people in the Moderna trial died from COVID. 0. So you won't die from getting the vaccine. That's one thing we know for sure.
Okay, that's good to know.
Right. End of story, period.
Hey, well, that's not the part I'm afraid of, is not the death. I'm afraid of the side effects.
Yeah.
So the second thing is...
Dr. Edgy, let me throw this question in from Tiana Jordan from Facebook, because it's going on to what Ebony's saying too. She says there's just a lot of I don't know, and it depends. There are too many uncertainties. She says you can still get COVID and not be affected, but you can still spread it. You can get the vaccine. She said if you get the vaccine, you shouldn't be able to get it or spread it. So let's talk about all that. And
that's my point.
What Ebony's saying too, yeah.
So if you get the vaccine, then you cannot get severe COVID, which means you won't be hospitalized. 0 out of 30,000 people got hospitalized. And again, this is to Dr. Bauer's point, the people who she sees who are the sickest of the sick, who got severe COVID, meaning they got in the hospital or died. So none of those 30,000 people who went in for the trial got severe COVID or died, period. End of that conversation. That's the first thing. Now, as far as side effects goes, the things that I talked to you about when you do get the vaccine are the 5 things we mentioned. Okay, so just to go over those again, you can get fatigue, so mild fatigue. You can get a low-grade temperature. You can get some myalgias, which will be body aches. You can get some muscle aches. Occasionally, people will have a problem with lack of taste, lack of smell if they get COVID, but that doesn't seem to happen with the vaccine itself. So we don't expect you to have any of those other things. I had a lead arm. It was just a heavy arm. I mean, they put a needle in my arm and it felt heavy, and that resolved within 24 hours.
Yeah.
And so to your issue about can you take the vaccine out, the mRNA, like I said, it's like a Snapchat message. it's gone within 24 hours. So there's nothing to take out. What it does is that snapshot, it's just like a flash of a camera in your body, and then your body responds to that flash and makes an army against the virus. And that Snapchat is gone. Just like a Snapchat is nowhere to be found. There's no mRNA to remove from your body. It's gone.
There's nothing you can come back from.
There's nothing to take out. It's gone.
It's gone.
Right? It's gone.
Let me give this quick a message from Facebook from Valerie Cummings Swope. She said that she understands teachers aren't getting infected at school. They're getting infected from other interactions. So she said, that's the case. Why are people so fearful of school? The township I live in within Hamilton County, which is Crosby Township, has not stopped school, and they have not had infection issues. So Valerie, thank you for sharing that with us. Okay, guys, we have like a few seconds left. Joyce, DJ, or J Doe, Ebony J, are you all feeling more convinced? Are you thinking, let's get that vaccine?
I'm still going to do my homework. I'm still going to do my homework.
Okay.
One of the things I would suggest is that this is definitely not a single conversation issue. Right. So if any of you would like to go ahead and continue the conversation with me offline, I'll be happy to do that. I understand this is a really personal issue. It requires deep thought. It requires trust. If you have a physician, that is one of the things that we found in a study by the NAACP, that is one of the most important things in helping you make your decision. So if you don't have a family physician, you need to find one and have that trusting relationship and have this ongoing conversation with them until you're comfortable with moving forward. So again, I acknowledge it's not going to take one closing the health gap, but you need to be able to go ahead and contact one of us. I'll be happy to talk to any of you in an ongoing way and try and help you get information. I can certainly provide you Dr. Kizzy Corbett, or at Dr. Kizzy. Again, she's one of the scientists that developed the Moderna vaccine. She's an African-American, 34-year-old brilliant woman. She is the brainchild behind this. She has an incredible amount of really important information that you can dig in and do your own research and have a discussion. But I'm fully available and to any of you for additional questions. And
first of all, I want to thank everyone. We are over our time, but what I want to say is that this is not the end of our conversation. Frankly, it's just the beginning. So what you all have told us is that we need to have more information, as Dr. Edgy and Dr. Bowers have stated. There are Black physicians in our community who you may be already being treated by, or maybe not, are the places where you should go to get some of these questions answered. But we are going to be back on January 30th, not next week, but the following week, with another panel of Black physicians who are going to continue to answer your questions. So here's the reality. This is a time for us to educate each other, because truly we must save us. And the only way we can do that is making sure we get good information, because it's about the information, and answer your questions to the best of all of the experts' ability, so that we can do all that we can possibly do to make sure we save lives in our community. And we can't affect the entire country, but we can save lives here. So I thank Dr. Bowers. I thank Dr. Edgy.
Amen.
I thank you, Miss Farley. I thank you, Ebony J. I thank you, DJ Doe. And I thank you, Tropikana and Jan-Michele Kearney, for leading this conversation, for being a part of this conversation. It is not the end. It is the beginning. And we are going to do all that we can from the Health Gap and from our partners with the NAACP, the Urban League, the African American Chamber of Commerce, Cincinnati Medical Association, and all the Black physicians in this county, to make sure that we get the information out in the ways in which we need your help in making sure we get it through the right platforms, the right channels. And that's what we have to do. So that would be my closing message. We look forward to hearing you and being a part of the conversation on January 30th. Please visit COVID19communityresources.com. Share questions that maybe you weren't able to have answered here today, so we can prep and be ready for those questions. But we are going to continue to provide information, because we want to make sure that you have the right information to share with your peers, so that you can get to the point of what Dr. And I know I'm not supposed to keep talking, but Dr. Edgy and Dr. Bowers said this. And I know you talked about 70 and 100, but let's look at it this way. In this country, if 70 to 75% of us are not vaccinated, we are not going to ever be able to get to whatever we call some kind of new normal, some kind of normal, whatever that is. So that is the reality. So what we have to make sure we do is figure out how we get questions answered, how we advocate for ourselves. And if that means more information, then that's what we are going to do. So I thank you all. You have a blessed weekend. Give all homage and lifting up Dr. Martin Luther King's messages that are unfortunately yet still to be accomplished in our country. So I thank all of you. Have a blessed weekend. Bye-bye.
Thanks, everybody.